And obviously it's a very serious problem, Alzheimer's. And, one of the things that is very, very much missing in the functional medical community is an understanding of these subacute chronic infections. Very few people are testing for them and associating them with severe chronic conditions. So, I think it's absolutely incumbent upon people, and I'm gathering, and I'll publish more data through blogs, that even people with the most minute bleeding gums with no root canals or implants can still wind up having a pretty good burden of infection below the gum line. So it's something we should not ignore, especially if your white blood cell counts, we talked about white blood cell counts in January, but especially if they're above 5,800 and your neutrophil to lymphocyte ratio is above 2 and your neutrophils are at 60% or more. Those taken together, you've got to dig under the covers. I just worked with a lady a little bit ago. We did the oral looked pretty good. Now we got to go someplace else. She has, rheumatoid arthritis. She's on Humira, spending a lot of money out of pocket, and the company that covers her health insurance is paying a lot of money for that drug. So, but I'm convinced white blood cell count of 8,300, rheumatoid arthritis, oral cavity looks pretty good. There's going to be an infectious etiology to that disease. The challenge is treating it. Identifying it's actually pretty easy, but treating it's another issue. But anyway, the whole purpose of tonight, there's an old slogan in storytelling or lecturing: tell them what you're going to tell them what you have to tell them, and tell them what you told them. And so really the whole purpose of tonight is anybody with concerns about Alzheimer's or a loved one with Alzheimer's is seeing a neurologist. This is a vascular disease. That's the whole point of tonight. There are very few purely neurological conditions. Even concussion, traumatic brain injury are going to have a vascular component. The blood is what brings nutrition, nutrients to the tissue, the cells, neurons, and carries it away. Very, very dependent on the vascular system. And what I'm going to show you is where a vascular disease emanates from. And we'll start off the show. So here's, we have two websites, Health Revival Partners. That's sort of our overall chronic disease program. And then even though I pay much less attention to this, Real Health Clinics is really focused on eye and brain disease. When you look at what we do in both programs, they pretty much overlap because our whole philosophy is 4 mechanisms drive disease. And where focal inflammation or infection is in a vulnerable person is where the disease can emanate, whether it's your joints, your eye, your brain, wherever. So we're pretty agnostic as to the actual diagnostic condition. But these series, so anyway, this is on the Real Health Clinics website. And there's the link. It's under causes on that website. And it's just a series of 4 short videos that show the connection between vascular disease and Alzheimer's. Not that I haven't shown enough of the literature references, and I have a few more or some repeats to show again tonight. But so, where did you learn that? Is what I always say to my health ministry folks. Where did you learn that? So you've learned that it's cholesterol plugging up a large vessel that causes heart disease in your doctor's office. And of course, just muting a little bit. Of course, it's the drug companies and the drug reps that bring these nice glossy pictures and brochures that the doctors can hang on their wall. But this is completely wrong. It's showing cholesterol building up inside, from the inside. And this can explain ischemic disease where you get blockage, but it in no way explains hemorrhagic, where the vessel wall out here is compromised and bursts. If it's all building up in here, okay, maybe there's a little extra pressure, whatever, but it really doesn't explain it well, and hopefully we'll explain it much better. But anyway, here's a very dear friend and colleague, Dr. Kilman McCulley, and he is a pathologist at Harvard, still practicing, still writing papers at the age of 86. He was summa cum laude medical school, #1 in his class, Harvard, in 1963 or thereabouts, thrown out of Harvard in 1969 because he refused to eschew the cholesterol theory of cardiovascular disease. He's the author of the homocysteine theory, but he's looked at things very broadly from a mechanistic perspective, and he's taught myself and Dr. Carter from his papers an awful lot about disease mechanisms. Now, I'm not going to go into a very long title of a paper, and it's obviously a scientific medical paper with a title like this, but let's break it down a little bit. Vulnerable plaques, the ones that can burst inside a vessel or burst the vessel wall, and leading to some type of vascular event, heart attack, stroke, whatever. Obstruction of the vasa vasorum. This is the key word here. And so we're going to spend a little time discussing what that is. And then he talks about microbial remnants. So he's talking about an infectious process affecting the vasa vasorum and causing vulnerable plaques. No one wants a vulnerable plaque in their body. You don't want it in your heart, your big vessels, small vessels, capillaries, doesn't matter what it is. So here's just an image. And so what this is, inside here, this is the inside of a large vessel. Inside of a large vessel. This is where the blood's flowing. But this is the vessel membrane, the endothelial layer. And it's a pretty thick, robust layer. Now, every cell in your body needs to be within at least 3 cell diameters of a capillary to survive. And the second you start losing integrity of the capillary, the tissue it was supporting starts slowly dying out. Of course, we can build new vessels. We'll talk about that when we talk about the eye. We talked about it when we talked about bad drugs. But anyway, here's the vasa vasorum, and it's actually a little larger than it should be based on the size of this. But basically, the vasa vasorum is the area where capillaries are highly concentrated within the cell membrane and supporting the health of the cell membrane. So what McCulley is showing here is that this vulnerable plaque that the traditional picture is showing building up on the inside is actually building up from the outside. It's this tissue here that's infected or diseased. And then we get this accumulation of cytokines, immune response things we see as neutrophils, lymphocytes, monocytes, foam cells, all kinds of different cytokines. Basically, it's a pus sac inside the vessel. No better way to describe it. And I actually have a little picture here. It's very much like a pimple. It's the exact same mechanism, okay? Picture this side here is where the blood flow is. This is the vessel wall. And then something on the outside here or on this side caused this accumulation of cytokines, a pus sac. And in the case of, if this is your skin, and this is a blackhead from a pimple, basically it's caused by acnes vulgaris, a infectious process. That's why things like minocycline are used to treat severe acne. So let's see, what did we skip? So what the McCulley article talks about, very important article, this paper here. So here's kind of the highlights. I talked about chlamydia pneumoniae, and I suspect my RA patient has that. We'll find out. It's not the only microbe found in atherosclerotic plaques. And if you listened to me and Dr. Carter before, we talked about chlamydia pneumoniae and oral pathogens quite a bit. So these Germans that McCulley quotes identified fragments of greater than 50 different microbial species with an atherosclerotic plaque. So heart disease, if you will. But not a single one in normal arterial tissue. And there's a reference. On average, people had 12 different species that had heart disease. Viruses found as well. Fungi, mold, most likely as well. Traditional is looking at antibiotic therapy, but a lot of times you get a single antibiotic. Ineffective. What makes it effective is improving your health. And of course, antibiotics are generally ineffective against viral infections. I know people that have glaucoma. They're as clean as I can tell from white blood cell counts and all the associated components of the white blood cell count. In fact, their white blood cell counts are low. They have cytomegalovirus affecting the vessels. They don't have a bacterial infection. So this is what we're looking at. And once again, Macaulay here, I'll relate it to the brain sooner or later. Macaulay here is talking about the microvessels. So really what Dr. Trump said, and for me, even though I'm an MIT guy and I'm supposed to be smart, as they say in Boston, it took me a little while to wrap my head around this. And he says, heart disease is a disease of the small vessel of the large vessel. Say that 10 times fast, Michael. But I mean, that's the point. There's no such thing as a large vessel disease. It's the small vessel. Well, I don't want to say no such thing, but really it's the small vessels. What I tell my populations when I work with groups is picture a double sink, and one has a big drain and one has a small drain. Which one's going to clog first? And they all say the small drain. And my response to that is, you now all know more than 99% of the cardiologists in America, because they don't understand it's a small vessel disease. And they look at those pictures on the wall and say, that's it. And so that's how they can't get to causation, because they don't realize this is a microscopic disease. It's not a macroscopic disease of cholesterol. Improvising as I go, Michael, with some of these things. But anyway, the eye is profoundly predictive and diagnostic of this whole process. The brain is the second most vascular tissue in your body on a per mass basis, and the eye is the most vascular. So here's the vessels supporting the retina, okay? And we're looking at a retina of someone who has dry macular degeneration, and we see these little yellow globules in there that are called drusen. And really, they're the same thing as that pus sac from a pimple or a vulnerable plaque inside a vessel, that they're an accumulation of cytokines. And what Dr. Don Anderson showed out of UC Santa Barbara is that included in this vulnerable plaque is the beta amyloid, which is the hallmark of Alzheimer's. Guess what? It's showing up in the retina in these little globules called drusen, which is tied directly to the vasculature of the retina. And so really, the drusen emanate from a small vessel disease under the retina. So proteotoxicity, I talked about this paper and I explained it's wrong. They call it proteotoxicity and cardiac dysfunction, Alzheimer's disease of the heart. But really, this is not proteotoxicity. These little globules of amyloid are actually responding to the small vessel disease infection. It's as simple as that. So when you look at Alzheimer's, and I'm not going to go into those 4 videos, what I basically do is I track a big vessel leaving the heart to a smaller vessel to an even smaller vessel to the capillary. So just so you know, there's vascular dementia. And that, a stroke is when a vessel like this gets either blocked off or, ischemia or hemorrhagic, whichever. And then down here in these smaller vessels, you may have an ischemic event or a hemorrhagic event and never know it because it's affecting a very small amount of tissue. And then you go down to the capillaries and you have one of these ischemic or hemorrhagic events and you really don't know it. And that's why when people go into Mass General with mild cognitive impairment, they already have up to 15, 18% brain atrophy because they've been losing these little networks. It's kind of like these micro vessels out here, the capillaries are kind of like the internet, okay? Whole lot of interconnectivity. So there's some redundancy there protecting the tissue, and you can lose little chunks without having gross changes to, your neuronal connections. So let's see. So I'm just going to take you through sort of our path. And, this is not the complete Tremp, Bredesen, Dr. Carter path. This is just a basic path for evaluating and then beginning to articulate what's going on with neurodegeneration. But, ultimately, I believe it's mainly a vascular disease. But the first thing, we don't do this often enough, but it's on the Bredesen protocol, is to get a baseline. Get a baseline brain test. And we use the CNS vital signs. It's a very robust, very accurate 6 attributes of psychological evaluation, all done online. So you don't have to see one of those nasty psychiatrists that are going to put you on some drug. Michael's laughing, of course. But we can do this online. You can do it from the comfort of your home, and it gives you a baseline. And more importantly, we can track your progress. Hopefully your progress, not regression. But either way, it's important to get information to see if we're heading in the right direction. So that would be step 1, baseline screening. The second, our chronic disease assessment. We give you a letter grade, you get your risk portfolio. You can work with one of us, health coach, try to start correcting these things. The devil's in the detail. What does the gut have to do with the brain? The brain is metabolically active. You have a lot of repair and recovery going on up there. If you have poor digestion, God help your brain, because it's extremely active and it needs more resources than other tissue. So, when we're looking at it as just a neurological disease, we're missing 95% of causation, most likely. The next one is our chronic disease temperature labs. We're looking for excess sugars, excess white blood cells, excess inflammation, excess repair and recovery, excess clotting, your kidneys working well, excess homocysteine, toxin to the brain, supplemental deficiencies, nutritional deficiencies. Get an awful lot out of the labs. So the I, step 4, pathology. So, the assessment, determinants of health, risks, physiology, pathology. This is a really interesting slide because this is a misfolded, I don't like that word anymore. Haven't liked it for 15 years, but it's an unfolded protein response. It's part of the innate immune response, but this is in a brain of an autopsied Alzheimer's patient. And the pathology tech that sliced the brain and stained this fibril didn't do it on the first try. Might have taken hours or days to get this perfect slice of the amyloid fibril in the Alzheimer's brain. And this is the exact same chemical composition taken with one of the most basic optometric tools, a slit lamp microscope, in 5 minutes in a living person. And Harvard showed that these two are exactly the same. So this is what's called a cortical spoke. It's pre-cataract, but in this case, it's pre-cortical cataract, and very few eye doctors look for it or report on it because it's a little more difficult to, you got to dilate the eye more, and you have to have a little tighter beam and a little more light intensity. It's not as fun for the patient. It doesn't affect vision, so what the heck? We'll just look for nuclear cataracts, and that's the number one surgery in the world, identifying and then removing nuclear cataracts. When you remove the nuclear cataract, I believe the cortical cataract, that's all part of the lens, comes out too. So if you've had a lens removed, we're not going to be able to see diagnostically the cortical cataract. But fortunately, this is not the only part of the eye that gives us diagnostics. Looking at the back of the eye, and no one's removing your retinal nerve fiber layer, thankfully, and we can see that and measure that with great precision and accuracy using a device very similar to MRI, but gives much more detail. So we're looking at the back of the eye. Looking for causal organisms, periodontal bacteria. Judith McCloskey, 25 years of evidence. We got to update this now, more like 30 years of evidence that spirochetes are causal in Alzheimer's. Balin, histopathological evidence in the brain, both spirochetes and chlamydia pneumoniae. Tansey at Harvard showing that the amyloids that can form in the brain are part of the innate immune response against infection. And then Bredesen wrote The End of Alzheimer's. We wrote the first book, End of Alzheimer's. Ours is more of a textbook. His was more of a functional approach. It's multifactorial. Chronic brain inflammation. Perlmutter talks about, really one of the good neurologists talks about type 3 diabetes. But Michael, do you want to go over the Bredesen 6-step protocol?
Oh, sure. So before I do that, just want everyone to really, truly realize the utility of our biomarker panel. So just like Dr. Lewis was describing, it starts out as a small vessel disease that ultimately goes to a large vessel disease. But, from a predictive standpoint, our biomarkers can tell you that years in advance before it becomes a problem. So looking at, the sedimentation rate or homocysteine or C-reactive protein or RDW or fibrinogen, insulin, etc. All of these different things, if those are out of the optimal range, again, not just above the normal range, but out of the optimal range, you have a much higher likelihood of having, something, whether it's Alzheimer's, Parkinson's, dementia, chronic disease, something ultimately most likely will befall you, especially in light of other things that might be filling up your bucket, such as toxins and medications and all of that. So that's why we really want everyone to do and understand, why we want people to do those baseline biomarker tests, which you don't get from your traditional doctor. Again, that's really, really important. A lot of people don't understand what we do is way, way beyond what you get from your traditional doctor. But at any rate, looking at the Bredesen protocol, which I'm trained in that. I was one of the first 300 doctors that was trained by him, probably about almost 4 years ago. And helping people, reverse neurodegenerative diseases. But basically, he kind of put it in 6 different categories. This really should have been 7, but the 6 main ones that he put together, type 1 being inflammatory, and of course, the whole host of things that cause inflammation. Of course, our biomarker tests really elucidates what causes inflammation. And of course, there are, a lot more exotic tests that you can do, like interleukin 6, interleukin 10 ratios, TNF alpha, TGF beta, MMP9, all of these things that, really confer, some inflammatory processes. Type 1.5 is, glycotoxic, meaning, kind of type 3 diabetes of the brain, where the brain can't utilize the glucose efficiently anymore, and it becomes resistant, just like other, body organs. So now the brain is pretty much starved. Type 2 is atrophic, which is a decrease in hormones. So in women, it's the estradiol, and men it's testosterone. Also decrease in thyroid hormone, cortisol, etc. All of these are critical in brain activity and mental acuity. And of course, as we get older, those things start to decline. Even in younger patients, a lot of those values are really, really not optimal. Type 3 being toxic. Some examples of that would be heavy metals like mercury that can come from, dental amalgams like silver or gold fillings. It can come from eating large fish, unfortunately, tuna and, the grouper and mackerel and all that stuff, those, can be very, very problematic in terms of sequestering mercury, in the flesh of the large fish and so forth. And if you can't detoxify, that becomes problematic. Also, mold, which is pretty much everywhere, but there are a lot of species of mold, and mold causes toxins in the body called mycotoxins. So, if your body can't detoxify the exposure to this, whether you unwittingly live in a moldy house or work in a moldy office environment, which of course there are a lot of locations that have water damaged buildings and water damaged houses, and you don't have to smell it, you don't have to see it. So, but it's very, very prevalent out there, and over time your body gets to a point where it gets overwhelmed, just kind of like the leaky gut syndrome. You go beyond the body's ability to tolerate these offenders, and then you kind of fall off the edge and you start getting symptoms and so forth. So, and that's the toxic type is really important in younger individuals, because we have 40-year-olds being diagnosed with Alzheimer's, which is quite unfortunate. And then we have type 4, which of course is the vascular reason, which Dr. Lewis went over, but very much underappreciated, especially from the small vessel standpoint. Even if, you get a coronary heart calcium score or a carotid interval media test, which it tests your carotids, and let's say those are all normal, that doesn't necessarily mean you're out of the woods, right? Because it doesn't test for the small vessel disease. So we kind of go back to, our labs and what that is showing. And then type 5 being traumatic, head injuries from, sports or, accidents or what have you, just damage the brain that can contribute to that. And then what Dr. Trimp, Dr. Lewis, more really focused on is the sub-acute infections, which, Dr. Bredesen really hasn't put a lot of emphasis on. It's kind of in there, but it really should be a category of its own, with the Lyme and mycoplasma, toxoplasmosis, et cetera, which we're all, we all harbor one or more of these things, believe it or not, but it's incumbent upon the strength of your immune system to keep these at bay from replicating. So those are really huge factors. And then offshoots from that, Dr. Bredesen talks about the 36 holes that need to be patched, and it's even far beyond that because we get into a whole lot of, the minutia of this, but, the 6 or 7 main categories are where you start to make sure that you're not going down a bad pathway. And if you actually have symptoms, then these are the things that we can start peeling the layers of the onion back to, say, okay, these are some of the things that, are much higher on the list. And these are some of the things that at this point we can eliminate for now as an outward cause of what's going on. But, since Alzheimer's is a very multifactorial, disease syndrome, it does take quite a bit of time and a lot of digging to really elucidate what's going on in most cases. Not in every case, but in most cases.
And Michael, the reason why it takes so long, when I first started doing record reviews of Dr. Tremp's work 20 years ago or so, I was shocked at how good the labs looked
Right.
in these people.
Yeah.
And at the time, I didn't understand it. And it took me a long time to figure out that we're talking about what Charles Mayo was talking about 100 years ago, focal disease.
Yeah.
Localized disease. So globally, in your 16 pints of blood or whatever we have in our body, when you have a little teeny bit of tissue inflamed, infected, whatever, then when we draw the peripheral blood, the dilution factor is tremendous. That's why you've got to look down under a microscope at these things.
Right. Absolutely.
And so very few people that have, I don't want to say very few, but I think at least 50% of the people that we work with have what I would call pretty doggone good labs compared to, people with other conditions. Those are the folks that have focal infection.
Absolutely. And, and again, it is all practitioner dependent, not necessarily tooting our own horn, but we have several individuals who come from various Bredesen practitioners, and a lot of things have been missed. So again, it really depends on, your experience, the time you've been out there, how much you've studied. Because I get numbers of those who I'm just amazed at, wow, you weren't tested for this, or you weren't tested for that, or they didn't ask you this. And, but there are a lot of doctors who really kind of focus on a niche category. They're very, very proficient at that. But, I'm more of a, we are more, we're looking at the entire person, and everything is important, and not necessarily saying you have to be this super, super specialist in this one area. So that becomes very important.
That's a detriment.
Yeah, absolutely.
I'm going to ping back and we'll finish up some slides here and then take questions. And oh dear, never with my commit again, or did I lose everybody?
Oh, I'm here.
I'm here.
It's telling me all kinds of weird stuff. So
You're good.
I don't even know what happened, but can you see the slides?
Yeah.
Yes.
Yes.
Hallelujah. Hallelujah. So we're just going to run through some quick ones here. This is chlamydia pneumoniae infection, and Dr. Tremp and I have a patent on this to talk about pretty aggressive pharmaceutical treatment of the disease. That's a path I thought was the only way to go a decade ago. Now I've changed my tune on that quite a bit, but at least it's there. One of the big problems with Alzheimer's is that the brain perpetuates inflammation much more than any other tissue. You bang your knee, in 3 weeks, the swelling's gone and you're up on your knee. But if you bang your head, could be better in 3 weeks, or it could be 3 years, or it could be longer. There's a real mystery behind the perpetual inflammation. So anybody that treats even these subacute infections and lifestyle and all that doesn't put you on a very aggressive, and I don't mean from a pharmacological, but a significant brain anti-inflammatory program, is probably not going to get the results you're looking for, because it's a major part of the etiology. No different than COVID. The virus, but it's the inflammation triggered from the virus that's actually the deadly component, the cytokine storm. And the brain is particularly susceptible to the perpetuation of that. So what Dr. Carter talked about, it's sort of a continuous improvement cycle, testing, retesting, looking for things we might have missed the first time, going for low-hanging fruit, diving deeper. The clinic we started years ago, I won't go through that. This is a paper that Dr. Tremp and I wrote, End the Epidemic of Alzheimer's by Preventing or Reversing Causation from Pre-Birth to Death. So you're a little depressed now? that's a risk factor for Alzheimer's in the future. You know, what does depression mean, though? I mean, there are all kinds of risk factors for depression. I'm always looking physiologically, but I was just very recently introduced to the whole concept of childhood trauma and how people lose years of life, even though they've had healthy lives in their during their adult years, from these kinds of events. Can't be, if you neglect something like this, you're missing another leg of the stool. Some more work on this is all from our Real Health Clinics website. Here's Dr. Tremp, Eyes, Window to the Brain, really talking about, full workup of retinal scanning, OCT, retinal nerve fiber evaluation, and looking at the front of the eye with the slit lamp looking at cataracts. Just, why Dr. Tremp was ahead of his time. He was looking at retinal diseases as tied to Alzheimer's back in the 1980s. And this is just a paper that shows the connection between the two diseases, very comprehensive. Really, Alzheimer's is glaucoma of the brain, and glaucoma is Alzheimer's of the eye. If you want to see some of our videos on patients improve, we don't do a lot of videos today, HIPAA and all that stuff, but we did a period in time where we did some videos. So there they are out on the Real Health Clinics website. Some published evidence. We've seen a lot of this stuff. There's Dr. McCulley's paper. We already talked about that one. It's all a disease of the small vessel. Here's Tanzi's paper at Harvard that says the amyloid that the drug company spent $250 billion trying to get rid of is actually part of your innate immune response. They knew better, but they were looking for just a basic thing. We talked about proteotoxicity. It's not. It's proteoimmunity is what it is. Completely wrong. New England Journal of Medicine, they got it 180 degrees out of whack. Wow, whatever. And then tau is the second hallmark of Alzheimer's, the amyloid. Then there's the beta amyloid plaques and the hyperphosphorylated tau neurofibrillary tangles. Say that 10 times fast. But this is from our book on the end of Alzheimer's that Dr. Tremp and I wrote, and basically says hyperphosphorylated tau appears in healthy animals when, interestingly, this Alzheimer's state of tau appears in hibernating animals. The common denominator is hypoxia, lack of blood flow, or in the case of hibernating animals, low blood flow. So obviously the tau, since all the tau research has failed so far to have any impact on Alzheimer's, it too is a protective mechanism for a brain that's not seeing complete good blood flow. More in periodontal, won't go into that. But this is the key paper. Inflammatory blockade restores adult hippocampal neurogenesis. So you got to block the inflammation, not just the cause of the inflammation. I always used to think 10 years ago, no, these guys are wrong. You block the cause of the inflammation, but I've learned in the last 5 to 10 years that traumatic brain injury, one-time event, perpetual inflammation, Alzheimer's, Parkinson's, ALS, slow matriculation of inflammation, but even if you get rid of the source, perpetuation of the inflammation is possible. Okay, this is just a little chart that shows the connection between a disease state, inflammation, and infection on PubMed. And researchers know a heck of a lot more than clinicians do, because cardiovascular disease is 2 million references when I did this 4 years ago, connecting cardiovascular disease and infection. And cancer leads to, cancer. What is cancer? It's a tumor, right? But they're back 4 or 5 years ago, and the numbers increased. 2.6 million papers in PubMed having some association between cancer and infection. So shouldn't we be looking there? Or should we just treat the tumor? The calcium hypothesis of aging and dementia. Infection causes precipitation of calcium in soft tissue. That's what the ischemia in infection is all about. The hemorrhagic aspect is that the infection will break down the endothelial. That's why people have bleeding gums. They have a little periodontal infection. It's easy to break those vessels because the endothelial, the cell wall membrane of the vessel, is breaking down. Adding calcium through supplementation is a bad idea for most people, unless you have a true calcium deficiency. And that's not ascertained in a bone scan. That's a good way to make money and funnel you into expensive drugs that aren't really good for your bones. But anyway, women have 50% more Alzheimer's than men. Part of it's they live longer, but calcification of vessels, small vessel disease, Alzheimer's, hopefully the puzzle is beginning to be pieced together. This is just talking about type 3 diabetes, so control your insulin. It's an easy risk factor. It's probably the easiest risk factor you can deal with just through diet. A lot of people later in life, their blood pressure goes up a little bit. The doctor tries to make an 85-year-old have the same blood pressure as their grandson who's an athlete. It's largely ridiculous. But now researchers say onset of high blood pressure later in life lowers dementia risk. Why? Because your brain is telling the kidneys to produce that blood pressure. I'm not saying you can't have a higher risk for stroke if your blood pressure's up, but that's why doing complex, older individual chronic disease management's no fool's game. It's always a balancing act. It's always a balancing act. Heartburn drugs. So there's a relationship between absorption. Heartburn drugs make you malabsorbing for critical nutrients that drive repair and recovery. So of course it's going to affect the brain potentially. It's just adding insult to injury. But this is the paper that really caught my eye. It was published about 4 years ago. I had a clue before then because Dr. Trump always knew. But this is really interesting. Moderate but persistent cytokine storms. What that means is inflammation. Moderate but persistent inflammation are typical of the chronic neurodegenerative states. And what this paper goes on to say is that they really are persistent. Both acute and unrelenting patterns of cytokine storms in the brain, in the ill brain. So it's not just treating the infection. I wish it were, but it's more to it than that. Let's see what else we have. Dr. Carter talked about shockwave therapy. It's being used not in this country, but in Europe to treat neurodegenerative diseases. Why? We know doggone well from the work that Dr. Carter's team has done in this country that this is a blood flow enhancement device and an anti-infective device and a immune system recruitment device.
Yeah.
And then things like Quiet Mind Foundation, Marvin Berman, finding if your brain waves are out of whack and trying to help you reorient them. And I'm going to have Dr. Dallas Hack hopefully present on what I think may be the most exciting new technology. Even though it's not new, it's just not well known. It does everything from brain optimization to providing significant relief to neurodegeneration, as long as you're cognitively functioning well enough to interact with the tool. It's actually a brain training tool that builds plasticity. So that technique is available today. It ain't cheap, and hopefully at some point it'll be cheaper. Just a little review. Step 1, baseline. Step 2, determinants of health, so on and so forth. I won't go into that. And with that, we will call it an evening, except for any questions. All I've got so far, Linda gave me a ha ha ha. Paula gave me a ha ha. So those are good questions. I love responding to those, but what does a brain anti-inflammatory program look like? What a beautiful question.
Well, I mean, it really depends on where you are, though. Again, everyone's individual. So we start with, our baseline biomarker test, and then we expand from there. Like I was describing, everyone has a different pathway, shall we say, and everyone has, different holes, like with Bredesen, that need to be patched up before you're, rectifying, the path that you're going down. So it can be as, reasonable as going through our chronic disease assessment, chronic disease temperature, maybe the oral DNA and getting a good handle on things. And that's a really, really great start. But then it could be, much more in depth with a lot of the testing that I do, where we're going down the pathway of heavy metals and, food sensitivity testing and mold testing and some of the advanced micronutrient testing, which really, really, elucidates quite a bit. And then some of the diagnostics tests, calcium heart score and carotid internal media, thickness test is still a very, very valuable, test technique, doing functional MRI, doing SPECT scans to see the volume of blood flow to the brain and the size of the hippocampus and all of those things. So we can get very, very exotic, with different things, but we always want to, still just start with the baselines. And really, it really kind of depends on, how you've answered your questions and your potential exposures where we go beyond what we provided for you in terms of the baseline biomarker tests.
And I think basically what Dr. Carter is saying is that an anti-inflammatory program for the brain is sort of a lifelong thing. It's not a simple prescription.
No.
You can go look at anti-inflammatory, liposomal this, liposomal that. But the biggest thing that I've learned with these types of complex diseases is you got to really evaluate the individual that wants to engage with you. And if they're fickle, forget about it. This is a long-term program.
It is very long.
6 months, you may see nothing. Okay. But we've seen inflections with a lot of people before that, but it's not always the case. There's a term, insulin resistance. I like to think I'm coining the term gut resistance.
Mm-hmm.
Insulin resistance, you're very insulin resistant, you get a little sugar, goes crazy.
Wow.
You're gut resistant, you throw a little probiotic in, your gut goes crazy. You're gut resistant. And there are going to be people that are Alzheimer's resistant. And
Well, and the other key point is, again, when you see your baseline biomarker labs that we do, and they are out of the optimal range, that tells you, again, that you're headed down the wrong path. And then when we go into the deeper tests, and there's one in particular that I do, it's called the Neurozoomer, which really, they're called predictive antibodies, and it pretty much emanates from, the hyperpermeability syndrome, but it tests about 60 different markers to your brain in terms of how your body's immune system is reacting to various parts of your brain. And just like when we show you that you have high immunoglobulin levels to various subacute infections, this test also shows high immunoglobulin levels to various parts of your brain. And if those are high, basically it is showing that there is destruction being caused to your brain over a slow period of time. So there's an extremely high probability within 5, 10, 15 years that you will end up with a neurodegenerative process if those levels are high and you don't change your course.
The question is, are you familiar with hydrogen water, and is it helpful in healing the brain? I know a bit about it. I know Dr. Carter knows more, but at the end of the day, mechanistically, everything is oxidation and reduction. Everything is a transfer of an electron. So fish oil, is it an antioxidant? Is it an anti-inflammatory? It's sacrificial. It oxidizes so your tissue doesn't. And everything kind of has a different potential for that. Some things aren't so protective because it takes a lot to oxidize them. Other things oxidize very easily. Some things go into fat tissue, some things more water soluble. All these things play a role in that. And I don't think we have all the answers for, some of these anti-inflammatories, but anti-inflammatory is sort of a misnomer. It's always a redox process, oxidation reduction. You can't have oxidation without reduction and vice versa. But Michael, do you want to talk specifically about hydrogen water?
Oh yeah, I'm a big fan of molecular hydrogen. So obviously you can get it in pills, or you can get it with a generator. I personally use it daily, especially before my workouts, and I find it to be quite beneficial, because it's really, giving negative electrons, to the body. It also gives you magnesium as well. So especially when you're using, not from the gas, but when you're using the pills, because when it dissolves, it actually, has magnesium as a component of that with the hydrogen. So you get additional benefits from that. And of course, everybody's deficient in magnesium, just like they're deficient in vitamin D. And one of the key points with that, magnesium being involved in over 800, enzymatic reactions in the body, what most people may or may not realize, that the conversion of vitamin D to its active form, the 125 hydroxy form, is actually also dependent on adequate magnesium levels. So again, in scenarios, especially with coronavirus, people are taking a lot of vitamin D, and, the vast majority of studies, of course, are showing huge benefits of vitamin D. But not all of the studies, but in the vast majority of the studies that aren't showing benefits, they're giving it kind of late in the game. But again, if that person is deficient in all of the other nutrients, including magnesium, again, they're still way, way behind the 8 ball. So these are crucial things to be taking on a daily basis. But yes, I do. I've actually talked to Tyler, who runs the Molecular Hydrogen Institute. I've known him, for probably about 8 years. So he's got some good stuff going on.
Excellent. David Harsfeld, Dr. Harsfeld is going to make a quick comment, then we'll adjourn for the evening.
Just thank you, Dr. Carter and Dr. Lewis, for what you're doing. Those of us that are doing stem cell work, cell therapy for sore knees and backs, let's say, if you don't do this first, this is prehab. If you do not get your immune system and gut healthy and get these lab values working, all those magic stem cells in your knee are not going to work, because these injections are not direct. They are indirect effects, like the refreshment card on the golf course. Your stem cells, if you've got a torn cruciate ligament, we're trying to inject stem cells to regrow it. We bring the Gatorade and the hot dogs. Your stem cells have to stagger over there and get that and go fix your ACL. These magical stem cell injections do not work on their own. And if you don't get your labs in selenium and cobalt, little things that Dr. Lewis is talking about, you have got to fix those first. So these stem cells, wonderful as they are, do not work on their own. So thank you, Dr. Lewis and Carter, for what you're doing. It's really changed the way our cell therapy success rate is.
What kind of cell therapy is there for the brain?
We are doing inhalation therapy. Is really interesting. It turns out they learned this with nasal administration drugs like insulin, they started doing, people don't like getting stuck with needles. So they started sniffing insulin. Well, within about 20 minutes, that insulin's in the CSF. So the neuroepithelium, that 2 millimeter layer of mucosa between the olfactory nerve and CSF, there's no blood-brain barrier. That's the scary part. We always battle that to try to get drugs across the blood-brain barrier, IV, intramuscular. Breathe it in your nose. In 20 minutes, it's in your CSF.
Yeah.
So we are doing inhalation therapy with platelet-rich plasma, bone marrow-derived stem cells, exosomes, really. That's an interesting topic. Within 20 minutes, it's in your CSF. And pretty soon the FDA is going to start supporting, and the NIH is going to pay for IV administration. We're working with people that have traumatic brain injury with the NFL. They're going to start paying for IV administration of these cells, biologics, and they go right across the blood-brain barrier. So we are really close, but again, they do not work directly. You have your endocrine system and gut, all that's got to be balanced, maximized. Otherwise, these things just go in and go out.
Thank you. That's really good. And I remember very vividly, I'll close on this. I always like to honor Dr. Trump. I was sitting in his office one day and he drew a very squiggly little black line image on a piece of paper. And he said, I'm an ophthalmologist, but the first sensory connection to the brain was the smell, sense of smell. He drew a little squiggly.
Cranial nerve 1. Yeah, absolutely.
Yeah. So very cool. Thank you, David. And thank you all for participating tonight. Next week, we're talking labs. So we don't know which ones, but there'll be a few labs we'll discuss in great detail. Bye for now.
Okay. It's not a vaccine. It's a genetic therapeutic.
What's interesting is that many healthcare workers aren't required to take it, not required. That's very unusual.
But that's a good thing. But, Rutgers, Rutgers, just recently announced they're trying to make it mandatory for all of their students. So Robert Kennedy and his, forces, came in to say, you cannot mandate an experimental anything for people who are employed or children or young adults going to school. So I think Rutgers is going to back down, but there have been several job sites that have tried to force their employees to take it. And so between Robert Kennedy and Del Bigtree, they're trying to really put things into place to help fight that. And I was trying to reach Vidar because there's some major issues going on in Israel. A lot of backlash to the massive vaccine. Well, it's not mandated, but basically the representative said it's as close to being mandated as one would get. And they're having, numerous, significant adverse reactions, numerous deaths that, of course, none of that is reported. So she's making a plea that, they're really trying to make Israel this location to say, oh, this is marvelous, wonderful, everyone should do this. And everyone should have these vaccine passports. So very, very disturbing what's happening out there, actually.
Wow. Michael, I've kept my nose out of it other than posting what Cliff Fetters published and what you published.
Yeah. Well, I already know 4 people personally that they know either a friend or a relative who within 2 weeks of getting the vaccine, they're dead. So I actually know more people now who got the vaccine and died than people that actually died from coronavirus.
Well, as a role model, you have to take a stance. And our stance is your good health will protect you against the flu.
Absolutely.
Against this virus, against the next virus.
Yeah.
So for me, it'd be hypocritical to take it, which I would never do anyway.
Oh, absolutely. But I'm still surprised that several of, the functional medicine practitioners who have taken it or are in favor of it. It's very interesting.
Michael, you want to know why? They don't have confidence in their own testing.
But yeah, exactly.
They don't really know where they are on the health disease continuum.
I mean, that's very strange. I was very, very shocked that some of the people who I felt would have never gone that way, but who are, I took it, and this, that, and the other. It's like,
deep down inside, they're worried about their health.
Yeah. They have to be because,
you have to be. Well, look, Linda said that her functional medicine doctor is promoting it too. But when you look at doctors on a whole, they're not a healthy lot.
Well, that is true. That's true.
When I presented down at the ACIM on the eye and Alzheimer's, Dr. Daniel Thomas came up to me afterwards and said, "You're one of the few speakers at this conference that actually looks fit."
Well, I think we are in a rarefied group. And you're probably right about that. That is an interesting observation, though.
Yeah.
That does make sense, because there are a number out there who, purport to being healthy and have done everything, but very few have really can, walk the talk.
Well, my own mentor, Dr. Trump, he took care of everybody else but himself.
Yeah, right. Yeah.
And he knew what to do, and he preached it to all his patients.
Yeah.
But then he was exposed to AIDS. Tuberculosis. He's right in everybody's face with the ophthalmoscope, and so he was
that's true.
To all kinds of things.
But I think you and I are, again, still on a pretty rare group in terms of what we do on a daily basis to make sure that we are always optimized. So, and just all the working out, all the physical things that you do. Yeah, I mean, not too many people do that.
Michael, I've done a little study in the state of Tennessee where we have very high obesity, the Bible Belt. And I'm going to plot this and I'm going to publish it. There's a strong correlation between waist circumference and the size of your rider mower.
Absolutely.
And you think I'm wrong?
No.
I know the p-value. Is at least 0.05.
I agree.
And with that being said, because I just did a little lawn mowing and I have a walk behind. Not a push, but I still have an old fashioned where you push it and you drive the rotary. I still have one of those.
Yeah, okay.